Hey YouTubers, so haven't checked in with my myomectomy for a while. I'm here at the hospital. I just left my pre-op blood work. So today is Tuesday, the day after Easter. Today is the 17th. My surgery is on the 19th. So today I came and did blood work, talked to them and gave them a prescription list of the medicines that I'm currently taking. They just went over what's going to happen, who I will see when I'm coming to do my surgery, which is at 7 o'clock in the morning. So I have to be here at 5:30 in the morning to talk to the anesthesiologist, make sure that I have a ride home from the hospital, and talk more with the doctor, and get any questions that I have answered if I have any, but right before the surgery. Last week I had paperwork, which is more pre-op, with my doctor's office, and just talking with my OB about everything there at his office. So there they gave me my medication that I will need after the surgery, which I was prescribed lorazepam and Percocet and another medication. I don't remember the name of it. I will get you the name of it if you would like to know. But it's one pill, and it's for me to take the night before I have the surgery. My insurance did not cover that medication, but it was only like $11. I haven't went to go pick it up yet, but I will go pick it up today. I will need it to take it tomorrow night before I go to bed. So I guess it like lights up everything down there when they're doing like an MRI or whatever. Actually, I had my MRI 2 weeks ago. I had MRI of the abdomen and MRI of the pelvis. I do have to go pick those discs up for the doctors, which I will be doing today. I have to give them those discs so they can see where everything is at. Like I said, I'm very confident with my doctor in that he knows what's best and the best way to go about things. So he wants those discs so he can see exactly where everything is so he can know before I fall asleep. He wants to know for sure whether he can tell me he can do it minimally invasive, which is robotic, which is the 3 slots, one on the belly button and one on each side of my abdomen, or if he'll have to cut me open. Now right now he says even with 10 fibroids and 4 or 5 of them being the largest, what he's telling me is that he likes to only be operating on the uterus for 1 to 2 hours at the most. If he goes in, then the really larger ones takes him a while. He will leave the tiny ones. And when I see the tiny ones, I have about 4 fibroids that are about pea size, and they go along the line. So he also stated that if they're close to like one of the ones he's working on, he'll go ahead and like take those out as well. But if he finds himself on the largest one and it's coming up to about 2 hours and he wants to just sew me up and get out of there. He also stated that with me having the large ones, depending on where they are, he doesn't want to rip me up all over the place because that won't allow me to have a successful pregnancy, which is the goal. So I'm taking everything he says into consideration. My fibroids cause a lot of pain during intercourse. They're like sitting on my bladder. If I cough, if I sneeze, I pee on myself. It is what it is. I pee on myself. It causes very, very heavy menstrual cycles. When I say very, very heavy, I mean very, very heavy. I had to stop working because when I was on my period, I had to leave for work the first 2 days. If I didn't, because I was a manager at a Sprint location, some of these days I didn't have anybody to cover for me. I couldn't just call off and say, hey, well, I can't come in, because there'd be nobody else to take my place. I would bleed on the seats, bleed through my clothes, change clothes, bleed through those clothes, bleed through a super heavy tampon on top of an overnight pad. And that would be in like increments of 30 minutes. I was changing pads, changing tampons. It was ridiculous. I completely stopped wearing tampons. And when I'm on my period, I wear heavy overnight pads, like diapers. I might as well be in a fucking diaper. Excuse me. Like I said, I also experienced a loss last year. At the same time, I had fibroids that were degenerating. I had fibroids that were growing faster than the baby was growing, till it got to a point where there was no room for him to grow. Now, after my water broke early, I was only 4 months, so my water broke, everything came out like a normal pregnancy would. It just was too early. After that, my uterus is still enlarged and extended. My uterus is measuring 16 weeks pregnant. So I look 16 weeks pregnant, which I'm tired of completely. So it just has to come out. It's time to go. It has to come out. So I'm leaving the hospital. My blood work is done. And I'm pretty much ready to go. I have tomorrow, a full day of tomorrow. I have my sister flying out here to help me with my business, and to also help with me, and my son. So I will definitely let you know day of. I will try to get a video in the morning, let you meet the doctor. Yeah, because this is a journey. Like, I'm excited. I almost want to cry. I feel like I'm getting rid of a piece of me, but then a piece of me that I've been ready to get. Like, you're evicted. Like, it's done. Like, your 30-day notice, you're at day 28 right now. Tomorrow's 29. At 30, you have to be out. You got to be done. It's really emotional for me, because this is the reason why I had my pregnancy loss. So it's kind of like an emotional thing as well. But I'm not scared. I'm nervous. I'm anxious. I'm excited. But my doctor did also tell me that the recovery is gonna be tough. And the reason why I know it's gonna be tough is because the medications that he's giving me, I used to have really bad cramps when I was younger, from age 16. So from 16 to now being 29, I've taken every medication that they could think of giving me that I can take during my pregnancy. And first I would take them for a couple of months, and then my body would just get used to it. So like the medication that he's telling me, well, I gave you lorazepam, which I already take. I already take Xanax for my anxiety from my Hashimoto's, which is a whole nother thing in itself, which doesn't do anything. It's 1 milligram. Usually I take it before I go to sleep. I don't take it for anxiety unless my anxiety is associated with me not sleeping. So some nights I will take it just to finally go to sleep. On the other hand, the Percocets are just Tylenol and oxycodone. That, I've been taking that for years, and it does nothing for me. It does nothing for me. So I feel like I'm going to have one of the toughest recovery times. And that's what scared me. The procedure, I'm not too worried about. I'm more worried about the recovery and sitting in bed in pain with nothing to help me with that pain. So I do want to log that for you that day of, and then the next few days after. I want to log for you guys, because I feel like that's the most important part, is the recovery and how you feel and how much pain you're in. I think that that's the scariest thing when people think of any kind of surgery, whether it's plastic surgery or whether it's the surgery that you need, is the recovery. How much pain will I be in? When will I be able to return back to my normal life? All of us are mothers, sisters, just grandparents or whatever. We have lives. How will this affect our lives in our everyday, day to day? So I just want to check in with you guys. Like I said, I'm leaving the hospital. That's the information that I have so far. And hopefully I'll have more information for you guys Wednesday. I will try my best to be able to upload a video Wednesday, April 19th, after my surgery. like I said, I will have my phone before. If I can get you to meet my doctors or just hear what's going on in the background of what they're telling me for you guys, so everybody can be informed of what this surgery is and what the steps are. If not, please be patient with me. I'm sure I'll be dying of pain in my bed. But for right now, I still have a smile on my face. And I will see you guys soon.